Where do you find like the motivation or the mission, or how do you get that to build up in you and to continue your work?
I think I've anchored it on, like, if you listen to the podcast just last week, like it was a lived experience, a person who's been through it. And I think those are the people I try to remember and always recall when I'm doing some of this work is like, I've been fortunate to get to know Gilletta Belton, Keith Meldrum, Tom Bowen, Pete Moore. There's many others, Tina Price in the UK. I'm trying to get more of those folks. And if there's any others that you all know that would share their story, because those stories need to be told. And that's where I've really enjoyed podcasting, almost as a little bit of a storytelling, and video creation is storytelling to get the stories out there, right? Because I think they're our best marketing tools to help. I think if clinicians are honest with themselves, and that's what I try to approach it as like, if you're honest with yourself, I know you see these people who aren't responding to the latest manipulation technique or needling technique. So I think there's pain out there in our clinicians. And that's really like when you're trying to bring clinicians into this type of world and maybe help them make a change. It's obviously not to insult them, like, you're doing it wrong, why are you doing it that way? But like, appeal to the pains that they have in their practice. And the pains that I had that I shared with y'all are the same pains they have. Like, and they might be in different stages of being able to come to terms with that pain, because sometimes I know for me early in my career, that's a patient issue. That's not me. They don't do their home exercises. They're not listening. They're malingerers, all the things that we do as clinicians to kind of more self-defense mechanisms than really being honest with ourselves that it's an us problem, that we don't have the skill set that we need, which is why communities like yours are doing an amazing job. So yeah, I think, using patients as our tool to communicate. And that's where part of my, drive lately is because in YouTube now, we don't have to like filter it through a healthcare system or filter it through any real, the barriers. Like, you can get a message directly in front of a human being who's struggling and who needs help, through YouTube and other avenues and other socials. And I think learning the skills to put your message, and also in front of clinicians too, because there are clinicians like I was ready to quit, and there are clinicians who are struggling, and there are clinicians who are, well, like, do I really need this next dry needling course? Is level 6 of dry needling going to be the answer, or maybe I need another approach?